Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Forum Health, the Wellness Forum Institute, and Make Americans Free Again. First of all, big announcement. You probably saw it in the newsletter yesterday. Our big, beautiful book, Conversations with Pam, The Power of Informed Healthcare, that I wrote with Heidi Plum, is out. It's available. It's on Amazon. You can download it to Kindle, and you can call our office and get an autographed copy. We'll be happy to autograph and send you one of those. And when you call, we still have some nutritional yeast at $12 per pound from an over order that we placed, and you can order that. It's still about half of what you pay per pound in retail stores. And you can order smoothie ingredients and possibly order enough smoothie ingredients to take the Happy Healthy Bootcamp that started yesterday for free. So there's still time to join in that because, of course, like everything we do, we record it. And for those of you who are members, we'll make this available indefinitely on your Documents tab. So you can go back and watch the yoga classes and the workout sessions and the cooking classes and that sort of thing. You can watch them again and again and actually use them as your workout platform. So don't miss this. It's only $195 for members, a little bit more than that for non-members, but we can fix that non-member program or problem, I should say, when you call us by just joining. We have memberships as low as $99. So anyway, don't miss this. It's amazing. And what we're hoping some people will do was just form the habit of doing some of these things, 4 days a week. So, and then continuing on even after the 6 weeks is up. So if you want more information about this, my email address is pampopper@wellnessforum.com. Last but not least, the next and last for the year, Winner's Circle starts this Thursday night. This is the behavior change, mindset change program. This will be the fourth time, maybe fifth, I don't know, I lose track. I've offered it. These are the principles that changed my life a while ago. And I promise they'll change yours. Spoiler alert, we do talk about God. And so if that bothers you, don't sign up. But if you think that God is a guiding force, this principle and this group of principles and these classes may be for you. Once again, my email address is pampopper@wellnessforum.com if you want more information about that. Well, I have two news items to share today. They're both related to some of the issues that Heidi and I discuss in our book. And so the first one is, and I'll tie this all together at the end. We all know we have an obesity crisis in the United States, but it's not limited to humans. According to the Association for Pet Obesity, there are about 100 million overweight cats and dogs in the United States. What's worse is that 36% of dog parents thought that their dog was normal, while the family vet classified the dog as overweight or obese. And the same was true of cat parents. 28% of cat parents thought that their cats were normal, while the family vet thought otherwise. In other words, people don't even know what normal dogs and cats look like anymore. This will really blow your mind, however, and it kind of made me angry when I read it. A biotech company, Okava, is developing an animal version of Ozempic right now. Okava CEO Michael Klotzman says that calorie restriction was typically prescribed for dogs, but it's too hard to maintain. Really? Last I checked, dogs were not purchasing the dog food or the treats and putting the treats and the dog food in the dish every day. Their parents were. I don't call them owners, by the way, because I just can't go there. I don't think of myself as owning Winston. I'm his parent, right? So I'm in charge of Winston. I put the food in the dish. It's my responsibility. Anyway, the new drug OKV-119 is a long-acting implant that delivers a dose of a drug that's similar to the current weight loss drugs for humans. It decreases appetite, increases feelings of fullness, and slows digestion. Klotzman goes on to say, OKV-119 mimics many of the physiological effects of fasting without requiring significant changes in feeding routines or disrupting the human-animal bond that often centers around food. I guess the human-animal bond that centers around food only works if we give the dog or the cat anything he or she wants. So parents are not expected to accept responsibility for their pet's weight and health, I guess, and providing appropriate portions and not responding to begging is just really too much to expect. The drug is also being developed for cats, and early studies show that cats can lose up to 5% of their body weight in just 112 days. For the record, overweight dogs live 2.5 fewer years than their normal weight peers, and chubby cats have a 2.8 times higher mortality rate. A recent poll shows that 52% of dog parents consider their dog's health to be just as important as their own. with 41% reporting that it's even more important than their own. Apparently, just not important enough to take responsibility for it, including portion control. Well, if this first news item didn't make your head spin, the next one will. A new systematic review and meta-analysis, which included 17 trials, showed that parent-focused behavioral interventions were not effective for preventing obesity in toddlers. The trials were conducted in high-income countries, and the results were that BMI at age 24 months was just about the same for kids whose parents were involved in early child obesity prevention programs and control families who were not given any instruction at all. The early intervention programs also did not result in increased vegetable consumption, increased physical activity, or better sleep. According to one of the researchers, quote, obesity is in large part driven by environmental and socioeconomic factors that individuals are unable to change. And while parents play an important role, they just can't be expected to reduce childhood obesity levels alone. Really? Instead, experts say, quote, broader coordinated action across society is needed to make healthy choices easier for everyone, regardless of where they live. Alongside for support for parents, we need to see coordinated policies which improve affordability of healthy foods, increase access to green spaces, and regulate unhealthy food marketing to tackle childhood obesity. The analysis was published in a so-called prestigious journal, The Lancet. In other words, parents can't be expected or even taught how to bring up normal weight healthy kids. Government intervention is required. We need policies like price controls and regulated advertising, more overreach from public health, which has been, by the way, a dismal failure since its inception, as we cover in our new book. Remember that public health drove the COVID debacle. These are the people who shut down the schools, closed the churches and synagogues, bankrupted hundreds of thousands of small businesses while building the wealth of the owners of Amazon and Walmart and liquor stores. But the bigger issue to me, and this pertains to the cats and the dogs and the children and all adults, is this. When the hell are we going to rise up and say no more? We can take care of ourselves and our communities and our pets and our children. Thank you very much. It's a simple process. We start with ourselves and we become role models for others. Read our book, loan it to another person, and spread the word. We can do this. Start a food over medicine club. Have some urgency about this. The time is now. Health is declining. It's starting at earlier and earlier ages, and most people in the world are going to look forward to a not so fun future as it stands right now. Nursing homes and memory care centers, even when they're reimbursable, are not fun places to end up and spend your final years. I feel like I've been preparing for this moment for 30 years. So let the conversation begin and the movement to health up the country follow. Help me do this. All right, that's it for today. As usual, pass this on to anybody who you think would enjoy watching it. I'll look forward to hearing feedback about what you think of our book after you read it. We're preparing a study guide so that you can have a book club discussion or even just form a group to discuss the book if you'd like to do that. So stay tuned for further developments. Thank you so much for watching. Have a great rest of your day, and I'll be back to you on Thursday with more news.